Disease-modifying anti-rheumatoid drugs, DMARDs. NSAIDs inhibit the production of inflammatory mediators such as prostaglandins and leukotrienes through the suppression of COX-1 and COX-2 enzymes. NSAIDs reduce the pain and swelling of rheumatic joints. However, NSAIDs do not suppress the progression of joint destruction. Glucocorticoids have broad anti-inflammatory effects mediated through a wide range of mechanisms of actions. Glucocorticoids are highly effective in short-term treatment of rheumatic joints. However, they have serious side effects with long-term use. Both DMARDs and biologics reverse the pathological course of rheumatoid arthritis with manageable side effects. But what are the differences between DMARDs and biologics? Biologics have specific immunological targets, which are mainly cytokines, and often TNF-alpha is targeted. Whereas DMARDs have a wide range of immunological targets and interrupt various immunological pathways. The drugs within the DMARD group have different chemical structures. Methotrexate drug is the most commonly used drug within this group. It is the first line of treatment. The Leflunomide drug is usually combined with methotrexate or used as an alternative if there are contraindications to methotrexate. Sulfasalazine and antimalarials such as hydroxychloroquine and chloroquine are used in combination therapy with methotrexate. Gold and cyclosporin treatments have intolerable side effects. They are used less frequently in the treatment of rheumatoid arthritis. Now we will briefly illustrate the suggested mechanism of actions for methotrexate. The first suggested mechanism. ACAR is metabolized by ACAR transformylase into FACAR. Methotrexate inhibits ACAR transformylase enzyme. This inhibition results in an accumulation of ACAR molecules. The increased concentration of ACAR suppresses the transformation of adenosine into inosine. The high levels of intracellular adenosine will trigger a cascade of anti-inflammatory reactions. Mechanism of action number 2. Methotrexate increases the expression of multifunction long non-coding RNA known as link RNA P21. Link RNA P21 mediates the inhibition of pro-inflammatory NF-kappa B activity. Mechanism of action number 3. Dihydrobiopterin is reduced by dihydrofolate into tetrahydrobiopterin, which is involved in nitric oxide synthase enzyme coupling. Methotrexate suppresses the activity of dihydrofolate reductase enzyme activity. This suppression results in an increase in the concentration of dihydrobiopterin, which enhances NOS uncoupling. NOS uncoupling stimulates GUN and terminal kinase activity. JNK enhances T-cell apoptosis, which results in the suppression of an immune response. Lastly, dihydrofolate is reduced by dihydrofolate reductase enzyme into tetrahydrofolate, which is essential for purine and pyrimidine synthesis, which are the major components of DNA and RNA strands. Thus enhances lymphocyte proliferation and the production of pro-inflammatory cytokines. Methotrexate interferes with dihydrofolate reductase enzyme activity. As a result, this suppresses the formation of the intermediates necessary for DNA and RNA synthesis and lymphocyte proliferation. These are the 4 suggested anti-inflammatory mechanism of actions for methotrexate. It is worth noting that the dose of methotrexate used in treatment of cancer is around 1000 milligrams, which is much higher than the dose of methotrexate used in treatment of rheumatoid arthritis, which is around 25 milligrams. It is widely believed that the folate pathways mediate the anti-cancer effect of methotrexate. But at such low concentrations of methotrexate, it is believed that the folate is not a major pathway involved in mediating its anti-rheumatoid action. Now we will briefly illustrate the main suggested mechanism for leflunomide. In mitochondria, the dihydroorotate is converted by dihydroorotate dehydrogenase into orotate, which is involved in the formation of uridine monophosphate, which is abbreviated as UMP. UMP is the main component of pyrimidine, which builds DNA and RNA strands, thus enhances lymphocyte proliferation. Leflunomide suppresses dihydroorotate dehydrogenase enzymes, thus suppresses the consequent reactions and results in the suppression of lymphocyte proliferation. Lastly, we will go through DMARDs combination therapy. Methotrexate is no longer used alone in the treatment of rheumatoid arthritis. Therefore, there are many suggested DMARDs combinations. For example, methotrexate is combined with leflunomide. Alternatively, triple therapy such as methotrexate, sulfasalazine, and hydroxychloroquine can be tried. Methotrexate could also be used with biologics. This combination induces the best radiological results and is well tolerated by the patients. Hopefully, you will find this presentation helpful. This video was designed by Dr. Jihad Hamad and Professor Susan Brain and narrated by Dr. Haya Al-Sheikh Khalil.